Good afternoon, my panelists. I'm Ebuwa Rosemary Omenogo, a student with math number group 2024 MPH SPH full-time 079. My topic is determinants of childhood immunization in Ndokwa East Local Government of Delta State. Supervisors, Professor Tobin Westin, Mr. Azoka Ijoma. My outlines are
You
shown
don't know your
on the
supervisor's name, oh. There's no Toby Westin. What is that the team or
Professor Tobin Westin.
is that the spelling of team? Is this the spelling of team? If it's Toby Westin.
TEEM.
You could EEM. I even still repeating it. Okay. Continue, please.
I'm not aware of this name. Oh. She's telling us a new name.
She says it's team and she spells the team as TEEM.
Background of study. Childhood immunization is one of the most effective public health interventions globally. WHO 2024. Prevent disease like measles, polio, diphtheria, pertussis. WHO 2023. It saves between 3 to 5 million lives annually. WHO 2024. Despite progress, coverage gaps persist, especially in rural Nigeria. National Bureau of Statistics and UNICEF 2022. Ndokwa East faces access, awareness, and infrastructural challenges affecting immunization uptake, UNICEF 2025. The problem statement: many children remain partially non-immunized despite availability of free services, UNICEF 2025. Rural areas show lower uptake due to poor awareness, distance to facility, cultural beliefs, fear of side effects, lack of local data in Ndokwa East, limits target intervention, National Bureau of Statistics and UNICEF. This study fills that gap by providing localized evidence on determinants of childhood immunization in the study area. Study justification provides localized evidence for Ndokwa East. Provide localized evidence for Ndokwa East. Supports policy making.
You have 7 minutes more. 7 minutes more.
Aim and objectives. This study aims at identifying the quantifying the key determinants of childhood immunization coverage and timeliness among children age 0 to 20 in Ndokwa East. Specific objectives: determine the factors associated with childhood immunization status in Ndokwa East to inform locally appropriate intervention. Describe patterns of vaccine uptake, full, partial, non-immunized, timeliness by community and facility. Investigate caregiver perception barrier, facilitators to completing the immunization schedule. Assess health system factors like vaccine availability, cold chain, outreach frequency. Study area. This study is conducted in Ndokwa East Local Government in Delta State, predominantly rural and riverine communities, with an estimated population of 193,710 wards and with settlements of 39,395 settlements, with 28 public primary health facilities, and one comprehensive health facility. Study design: community-based cross-sectional studies. Data collected at one point in time focus on caregivers, health workers, suitable for identifying association and pattern. Caregivers of children 0 to 23 months in Ndokwa East. Health workers involved in immunization in Ndokwa East. Inclusion and exclusion criteria. 1. Caregiver, mother or guardian of eligible children who consent to participate. 2. Residents who have lived in the area for at least 6 months to ensure exposure to health services. Caregivers who are not permanent residing in Ndokwa is less than 6 months. Caregivers who cognitive, communication or health limitation that significantly impair their ability to provide
5
accurate
minutes,
and
ma'am.
constant sample size calculation. Sample size determination for this study is the use of Cochrane formula with the sample size as N, Z as score, estimated population of the attribute as P, and is calculated with the sample size gotten as final sample size 354 for caregivers, 354 for caregivers, then 10% non-response of 35, giving us 389. Sampling size: multi-stage sampling method. Multi-stage sampling: random selection of wards, random selection of settlement, systematic selection of household, one caregiver per household. The approach ensures representative of the study population and reduce sampling bias. Sample size distribution. Total sample size 401 respondents. Caregivers 351 with 87.5%. Health workers 50 with 12%. Caregivers by key characteristics. Majority age 25 to 34 years. Predominantly secondary school leavers. Then majority residing within 30 minutes to the facility. Study instrument /2 process. 2 use the structured questionnaire. Administration method: physical with caregivers. And questionnaire 2 to the healthcare workers. Objectives to be measured: access childhood immunization status, caregiver knowledge perception and barrier to vaccination. Ethical and permission. Ethical approval was obtained from the University of Port Harcourt Ethical Approval Committee. Permission was secured from the relevant health authorities in Ndokwa East local government area. Informed consent was gotten from the participant before data collection. Data management: reliability, validity. Response rate: total respondent 401, caregiver 351 respondents. 200 determinants of childhood immunization. 50 response from healthcare workers. Then caregiver demographic, which is in line with the first objective. Under demographic, we have the greatest age of 25 to 35 years. Then the demographic captures also the educational level, which we have most of them in secondary school level at 80.1. Then the significant relationship between education and immunization, which we have those of educational level of secondary school. Majority are traders and traders farming.
Wow.
Under the immunization status, we have children who have never been immunized and children who have been immunized partially. We have the graph of 97.4 as children vaccinated taking the first vaccine. And it is seen that as they progress, they deteriorate. At least one in each of the vaccines are taken, and it is in the highest grade with BCG. Caregiver health workers systematic factors. Health workers systematic factors comprises how the health facilities get their stock of vaccine. We have here the graphs of the vaccine availability. Unavailability of stock, sometimes unavailable 60%, always available we have 40%. Then under the health worker system factors, we also have outreaches, which we have irregular outreaches at 56%.
Okay,
And regular
your time is up.
outreaches.
Actually, your time is up. All right, you spent 1 minute extra. Just move your slide to the end. Move, 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 move. Short time. Okay. Dr. Wogu, please, are you there? Is it my network? Dr. Wogu? Okay. Dr. Kanu?
Okay. Well, I did, I did understand this presenter very well. Please go back to your title slide. Your results were not clear. Go to your title slide, please. Okay. Determinants of child immunization. Ndokwa is data state. Okay. Determinants of child immunization. Okay, so go to your objectives. Go to the objective page. So your main topic is to find the determinants of child immunization.
Yes, sir.
Okay. All right. So looking at this your objective, I think the arrangements, first of all, the arrangements should be better, not this way. Since the determinants of childhood immunization factors. If you look at health system factors, they are also part of the factors that affect childhood immunization. So they can actually be inside the other objectives. However, the first objective, probably looking at this form, should be to look at the pattern of formation of uptake, maybe. And then, yeah. The population, what's your population of study?
Major population, but healthcare workers are also, because of the factors that childhood immunization, like vaccine availability.
Okay, so it means that you have two population.
Yes.
Then if you have two population, you're supposed to show us the sample size, how you calculate it. I didn't see it in throughout this presentation. I didn't see how you got your sample size.
It, not,
They are not, yes.
they are not
And
specific.
I did not, they are not. They are not. And I did not see how you calculated any samples. I just saw 401. I don't know where you got that, how
Sir?
you got that.
Okay, is there sample
How
size
did you
calculation, sir?
how did you arrive at that? How did you get the sample for caregivers?
For the caregivers, I use
What was your proportion? What was your proportion?
the proportion for caregivers is
What proportion did you use?
I use women of childbearing age.
Mhm.
Then the healthcare workers, I used
Women of childbearing age who did what?
who have children that are taking immunization.
Okay, so women who have children who have taken immunization.
Yes, sir.
Yes. Is this 60? Is it where you got 64 or something? What
Yes,
did you get?
as yes, from the population of the
Uh,
LGA.
from a study done somewhere, somewhere. Abi?
I got it from the population. There is not much study
Mm,
on this topic of
mm.
determinants of childhood immunization in Ndokwa East. I went to the
No, there should be. No, there should be. There should be population of students who are immunized. Is it not what you use?
yes of
You are looking at
children.
immunization. People are
Yes,
immunized.
sir.
Uh-huh. So there has to be. How did you get 64? 64%. Is it not? Let me see. That place you see your P. What's the measurement of your P? How did
Estimated
you get P?
population of the attributes, which is from the total population using
It's attribute. Attributes. Which attributes you use? Immunization now.
yes, sir.
And type who are immunized. So where is it? Where is it? How did you get it? Where? Which study? I'm not seeing it here. Is it in the previous slide or after this slide?
Is in the previous slide where I said the population of the
Go
LGA.
back to the go back. It's not LGA population.
See it, yes, sir.
Population of LGA has nothing to do with this sample size, please. Hmm? I'm not sure you are meeting your supervisor. It doesn't look like. It doesn't look like. Eh? It doesn't look like. This thing you are talking now is not inside here. It's not in the LGA. Eh? There should be a study of immunization for under five. You're looking at women who are taking care of under five children. They are the people that are immunization age, is it not? Eh?
Yes, they are the people taking care of the
Uh-huh.
under five.
So you should have found out a study on immunization of under five, if for
Yes,
no
sir.
other thing.
It's 20% of the population, sir.
Eh? That's not. That one is completely wrong. Hmm? So this sample size is just we don't know how you arrived. You just did magic and just arrive at it. There is when I was looking at what proportion you use. I'm not. Go back to the next slide. There's nothing there to show. Go to the next slide. There's nothing to show there. Nothing. Hmm? There's nothing there. Can't see anything. Hmm? You calculated sample size. You just jump to 401. Go back to the place you have your formula. Hey, this formula. Eh? Where is where is the value of P? Yes. There is no value of P. I didn't see any value of P. The only thing is that in your formula, I was just saying 36 and 64. I don't know which one is valid. I don't know how you got it. So this one now, you have not said anything. So this your sample size is wrong. Oh, is not correct. Hmm? This is not how to go about it. Hmm? And then you now say you are doing health workers. Health workers, how did you arrive at getting 50 health workers? Which formula did you use to get that? Which formula
Yes,
did you use?
I use the Cochrane formula to get my sample
No,
size.
no, you didn't
N
use
is the population of
it. You
the
know,
area. So getting the children under the immunizable age is
madam, 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 you did not. This your dollars. How did you get 50? How did you get 50? Can you explain?
the health workers that are in the
How did you get
healthcare
50?
workers.
All right.
How did they arrive
Dr.
at
Kano,
50?
are you having network challenge?
I'm not having, are you not hearing me? Hello?
Okay, I can hear you now. Go on, go on.
Eh,
There was a blank
eh,
pause.
I
okay.
got the health worker sample size from the health workers in the local government.
The
No,
problem
no,
is,
it's wrong.
presenter,
Hmm?
Rosemary, you don't
Hmm?
understand. That's why
Hmm.
you're still arguing. If you're
Hmm.
calculating using a particular attribute, what is the attribute? Now you calculate
Mhm.
for caregivers. We are supposed to see the one for healthcare workers. We are not
Mhm.
seeing it. We're just seeing an arbitrary number of 50
Mhm.
appear. But you're explaining and you don't even understand what they're saying. That makes it
Mhm.
worse.
Mm,
That just makes it worse.
madam, you did not.
I
I'm not
don't
sure
even
you
know
did
how
it.
to
I'm
help
not
you.
sure you did
Starting
the work.
from your specific objective, that's where the issue came from.
Mm,
Your specific objective at this point is still not smart. Then
it's
how do
not.
you measure it? What will we see at the results? How do you
Mm,
start your specific objective with determinants of something? Something you have
mm,
not assessed. You want to look for the
mm,
determinants. Where do we go from there? That's a huge
mm,
problem. At least the ones we've seen since morning, we didn't quite have a lot of problem with the specific objective. This should have been cleared from proposal. How do you
mm,
start your specific objective with determining the factors associated with childhood immunization status when you have not determined childhood immunization status? And which of the immunization status are we looking at here?
mm,
Immunization status, all of them, and be able to find the determinant of each of them. What exactly would this represent? Or is it anybody that has been vaccinated at all that will comprise this immunization status? From that specific objective, if it's not clear, then what are you going to be measuring?
Is not
You should have measured immunization coverage. That's what you mean to say there. If you're measuring coverage, you need to have, say all the vaccines you want to assess their coverage. And then you know what you're talking about. Before you can do a determinant of something, it means that that variable is recategorized into binary. That way you'll be able to show us determinants. But that's not how your objectives are crafted, and it's a huge problem. So this, what's the verdict for this person? A lot of work needs to be done here.
mm. No, a lot. See, your results are all different angles. It doesn't show any direction.
We are not
I
speaking to
don't
anything because the
understand
objective is not
anything in this
specific.
world. Mm, Please, this one. You may need to go back to the drawing table and then start all over again very well. Now, his masters, he wants to get to. This one not even trying to do. This one a
Sir,
masters.
please, the immunization status is about the different vaccines they are taking, which is on the second objectives, and it is categorized by the different uptake. Non-immunized.
So how many of the vaccines are you interested in?
I used seven.
You are interested in 7 of the vaccines. So you would assess uptake for all the 7. and find the determinants of all the 7. Is that what you want to do? In that case, you see
The
determinants
fallout
of all of
by
them.
the time they get to measles and yellow fever. That is the
That is
analysis
it the
I
same
did
thing
here.
as determinants?
That is what determines them not to take it up to the becoming fully immunized.
Karen. Thank you.
I think the
Next
candidate
person,
doesn't
please.
understand the whole concept. I think she will need
That's what makes it worse.
to
Assuming as we are making the comment, she's even understanding where
understand
we
it.
are
So she
headed.
doesn't
It
understand
will make
that
sense to, she needs to
this
go to the drawing board back
she needs
from
to come
the
and sit down
specific
with the
objective.
supervisor
I'm
on
not sure
foreign.
she did because if she
She
did,
may
that
not have
specific
done.
objective would have been corrected and
It
she
has
would
been
not have
corrected
carried it like that to this state. This one is
to
more
this stage.
fundamental issues than we have
Very
even seen
fundamental.
today.
We can't go on with this. So she needs to go back.